November is Lung Cancer Awareness Month, and this morning we're going to get some important reminders on what to think about when it comes to our lung health. Here with more is Dr. Todd Freudenberger, a pulmonologist with Overlake Medical Center and Clinic. So thank you for being here.
Glad to be here.
So let's talk about what lung cancer is.
So lung cancer arises from cells that are normally present in the airways and in the lung tissue, and as those cells mutate or change and grow, they either stay there or sometimes they can spread to other areas, like they can spread to the lymph nodes or to the bones or to the brain. So that's what lung cancer is.
I lost a dear, dear friend, like my second mom, to lung cancer, and it went to her brain quite quickly. So I know it moves easily, and it's very serious. So one of the problems is she didn't catch it fast enough. So let's talk about signs and symptoms.
Yeah, so that is the problem with lung cancer, is that often when it's present in its earliest stage, people don't have much in the way of symptoms at all. And so it's only when it becomes more advanced that they start to develop symptoms. And that might include cough, for example, that doesn't go away, or a change in the amount of mucus that they produce every day. Sometimes they might notice a little bit of blood in their sputum. It can cause shortness of breath. It can cause recurrent pneumonias or infections like recurrent bronchitis. And then when it gets a little more advanced, people can have things like unexplained weight loss and fevers and sweats. So
and then you need to really get in to see you.
Yeah, hopefully way before that.
Okay,
yes,
okay, let's talk. Okay, so let's talk about who is at risk and why it's important to have regular lung cancer screenings if you are at risk.
Yeah. So smoking is by far the biggest risk factor for lung cancer, and 1 in 16 people that smoke will go on to develop lung cancer.
1 in 16?
1 in 16 smokers. And the more you smoke, the greater your risk for lung cancer. The good news there, though, is that if you stop smoking, then your risk for lung cancer goes way down. So that's all positive. And you know, it's unfortunately pretty common condition. So 230,000 people every year are diagnosed with lung cancer in the U.S. 130,000 people die of lung cancer in the U.S. It's the most common cancer killer for men and women. So what we want to do is screen people. We want to catch the cancer when it's still early and people don't have symptoms. And
what does that screening look like?
So at Overlake, we follow the United States Preventive Services Task Force recommendations for screening. It's the same set of recommendations that the American Cancer Society also endorses. So anybody who's between the ages of 50 and 80 and who's either a current smoker or who has stopped smoking within the last 15 years are eligible.
Doesn't have to be a heavy smoker, right? Or is that part of the criteria?
Yeah, so you have to have smoked at least 20 pack years. And the way you figure that out is you take the amount that you smoke per day, like let's say you're a pack a day cigarette smoker, and you've smoked for 20 years, that's 20 pack years. Or if you're a 2 pack per day cigarette smoker and you smoked for 10 years, you can also arise at that 20 pack years. So those are the criteria, those 3 things: age, the recency to smoking, and then the pack years.
So there's a lot of shame to smoking and to people who have smoked, and I think because it's an addiction and people need to realize that, and so I think people are maybe afraid to come in and come to a screening. So why is Overlake the right place for them?
Yeah, so screening is, I think, a very easy process. It's not any different than getting your mammogram or getting your colonoscopy. I think we'd like to normalize it to make it feel like, like every other kind of screening procedure. The people so I think at Overlake, I find that there is a group of really well-trained providers there that are best in the area. I think that Overlake has or offers its patients a tremendous patient experience. The patient experience scores are highest in the nation.
So there's that level of kindness and not having to worry about the judgment and just coming in to get medical help.
No judgment, just come and get help. And if you come there, the Cancer Center at Overlake offers you access to really a comprehensive set of experts. You can get cutting-edge therapies. We have designer drugs that are very specific for tumor types, or immunotherapy, which are medications that help someone's own immune system work better and cutting-edge surgery techniques and radiation technologies. So really a good place to go. So
wow.
definitely recommend it.
So you have everything you need there. Thank you so much for taking the time to share this with us. For everyone out there, to make sure that you're getting your screening. I feel very comfortable coming to you. I know so many people will, so that will be a wonderful thing for people to be able to.
Thanks for having me.
Absolutely, to go check it out, just to know. Wouldn't you feel better knowing? And so to learn more about what we discussed today, just visit the website on your screen, overlakehospital.org/lung cancer.
This portion of New Day Northwest is sponsored by Overlake Medical Center.